Dry mouth, medically known as xerostomia, is a condition where your salivary glands don't produce enough saliva to keep your mouth moist. While this might sound like a minor inconvenience, saliva plays crucial roles in your oral health and overall comfort. It helps you swallow and taste food. It contains enzymes that begin breaking down food and helps wash away food particles and bacteria from your teeth and gums. It also contains minerals that help strengthen your tooth enamel and proteins that fight bacteria and fungi, protecting you from infections. When you don't have enough saliva, these functions are compromised, which can cause symptoms such as bad breath, dry throat, and cracked lips. Dry mouth isn't a serious condition on its own, but in most cases, it's a sign of an underlying problem. The condition affects approximately 1 in 4 adults to some degree, with higher rates among older adults, where the prevalence can reach up to 50%. Causes of dry mouth. Dry mouth can develop for a variety of reasons, and in many cases, multiple factors contribute to the condition. One of the most common causes is medication use. Many prescription and over-the-counter drugs, including antihistamines, antidepressants, blood pressure medications, and decongestants, can reduce saliva production as a side effect. The more medications a person takes, the higher the likelihood of experiencing dry mouth. In fact, over 500 medications list dry mouth as a potential side effect. Medical conditions also play a significant role. Autoimmune diseases such as Sjogren's syndrome, lupus, and rheumatoid arthritis can damage the salivary glands, leading to chronic dry mouth. Diabetes, on the other hand, affects fluid balance throughout the body and can cause dehydration and reduced saliva production, especially when blood sugar levels are poorly controlled. Nerve damage from head or neck injuries can also interfere with the signals that control saliva production, making it difficult for the glands to function properly. Other than these conditions, cancer treatments frequently cause xerostomia through different mechanisms. Radiation therapy directed at the head and neck can damage salivary glands caught in the treatment field, sometimes permanently reducing their function or destroying them entirely. Lifestyle factors also contribute to dry mouth in many cases. Dehydration from inadequate fluid intake or excessive fluid loss through sweating, vomiting, or diarrhea reduces the body's ability to produce sufficient saliva. Tobacco use, including smoking and chewing tobacco, directly irritates the oral tissues and affects salivary gland function. Breathing through your mouth rather than your nose, whether due to nasal congestion, sleep apnea, or habit, exposes the oral tissues to more air, which accelerates moisture evaporation from the mouth. In some cases, aging itself contributes to xerostomia. Older adults naturally experience some decrease in salivary gland function. They're also more likely to have medical conditions and take medications that cause dry mouth. Symptoms of dry mouth. The experience of xerostomia goes far beyond just feeling thirsty. The most obvious symptom is, of course, the sensation of dryness in your mouth. Many describe it as feeling like cotton has replaced the tissues in their mouth or like their tongue is sticking to their palate. This dryness often extends to the throat, creating a persistent feeling of thirst that doesn't resolve completely even after drinking water. Your lips might become chapped and cracked, while the corners of your mouth may develop painful splits called angular cheilitis. Many people also notice diminished taste sensation or altered taste perception, since saliva is necessary for dissolving food particles that stimulate taste buds. Dry foods like crackers or bread become difficult or even impossible to eat without liquids to help moisten and form them into a swallowable bolus. You might develop a burning sensation in your mouth, particularly on your tongue, known as burning mouth syndrome. Speaking for extended periods becomes challenging as your tongue and oral tissues lack the lubrication needed for comfortable articulation, potentially causing hoarseness or difficulty being understood. Oral health complications often develop as dry mouth persists. Without adequate saliva, you lose its natural cleansing action and antimicrobial properties, leading to increased plaque buildup on teeth. This creates a higher risk for cavities, especially around the neck of the teeth near the gum line. Gum inflammation, or gingivitis, becomes more common, potentially progressing to periodontitis, which is a more serious form of gum disease that can lead to tooth loss. Bad breath, or halitosis, frequently accompanies dry mouth due to food particles remaining in the mouth longer and increased bacterial growth. Many people with xerostomia develop oral candidiasis, a fungal infection commonly called thrush, which appears as white patches that can be scraped off, revealing red, irritated areas underneath. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of dry mouth. Diagnosing xerostomia usually begins with a discussion of symptoms and a review of medical history. A doctor or dentist will ask about medication use, lifestyle habits, and any underlying health conditions. A physical examination of the mouth may be conducted to check for dryness, redness, sores, or signs of tooth decay. If necessary, specialized tests can be performed to measure saliva production. One common test is the salivary flow rate test, in which saliva is collected over a specific period to determine whether production is lower than normal. A silography may also be performed, which is an imaging test that involves injecting a dye into the salivary glands to assess their structure and function. Finally, blood tests may also be conducted to check for markers of autoimmune disorders or other medical conditions affecting saliva production. Treatment for dry mouth. The treatment for dry mouth depends on the underlying causes. Here are the most common treatment options. Number 1. Saliva substitutes and moisturizers. These products aim to replace missing saliva or provide prolonged moisture to dry oral tissues. Over-the-counter saliva substitutes come in various forms, including sprays, gels, lozenges, and rinses, containing ingredients like carboxymethylcellulose, hydroxyethylcellulose, or glycerin that mimic natural saliva's lubricating properties. Many products also contain xylitol, which helps prevent cavities and stimulates your own natural saliva production. While these products don't address the underlying cause of xerostomia, they provide immediate temporary relief from dryness and discomfort. Mouth moisturizing gels typically last longer than sprays or rinses and can be particularly helpful at night when saliva production naturally decreases. Number 2. Medications to stimulate saliva. In some cases, doctors may prescribe medications such as pilocarpine or cevimeline to stimulate the salivary glands and increase saliva production. These medications work by activating the nerves that control saliva flow, providing relief for individuals with chronic dry mouth. They are typically taken 3 times daily, and they start working within 30 minutes and their effects last for several hours. Common side effects include sweating, headache, increased urination, and digestive upset, as these medications stimulate not just salivary glands, but other exocrine glands throughout the body. Number 3. Treating the underlying condition. When dry mouth results from underlying medical conditions, treating the primary disease often improves dry mouth symptoms. Help control the autoimmune process that damages salivary glands, potentially preserving remaining function and preventing further deterioration. In diabetes, achieving better blood glucose control through proper medication, diet, and exercise can significantly reduce dry mouth symptoms by improving overall hydration status and reducing excessive urination that contributes to dehydration. Number 4. Medication adjustment. Since medications represent the most common cause of xerostomia, reviewing and potentially modifying your medication regimen offers a targeted approach to treatment. This process begins with a comprehensive medication review by your physician or pharmacist to identify drugs known to cause dry mouth. When possible, substituting an alternative medication with the same therapeutic effect, but less impact on salivary function, can dramatically improve symptoms. Number 5. Oral hygiene modification. People with dry mouth need enhanced oral hygiene practices to compensate for reduced protective effects of saliva. Using a soft bristled toothbrush with gentle technique prevents damage to dry, vulnerable oral tissues while still effectively removing plaque. Fluoride toothpaste with a higher concentration of fluoride than regular toothpaste provides extra protection against the increased cavity risk. Daily flossing becomes even more critical as food particles aren't naturally washed away by saliva. Finally, an alcohol-free antimicrobial mouthwash helps control bacterial growth without further drying oral tissues. At the end, whether your dry mouth stems from medications, medical conditions, or lifestyle factors, effective strategies exist to provide relief and protect your oral health. Now, we want to hear from you. Have you ever experienced persistent dry mouth? What triggers have you noticed, and what remedies have worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.